critical care to patients, in particular those who are COVID-19 related. And we've seen decreases and below that threshold 10 of the last 14 days. Now, one of the measures where we haven't seen as much improvement as we'd like to, and we continue to follow this, is our acute care bed utilization rate. So I'm sorry, I got those backwards. So our acute bed utilization rate continues to trend downward in terms of 68%. The challenge is our ICU bed capacity. So our ICU bed capacity, 4 of our 6 hospitals over the last week have been at capacity for ICU coverage. And certainly we want to see that number come down and continue to move down. This morning, the numbers were better than the day before, because that will also be a good measure of our hospital and health system ability to absorb any potential surge in cases over the near future and as we move forward. So we want to make sure that we have adequate capacity to be able, not only in just general hospital space, but also from an ICU care coverage perspective. Now, when we look at COVID-related hospitalization rate, that was also another measure put out. We've seen 36 visits per 100,000 residents, and that's a rate that on the 3-day average has decreased 11 of the past 14 days. When we look at the percent of ventilators in use, which is a good measure and proxy for our critical care supplies, we have been below, we have met our threshold that we put out in making sure that we had approximately 40% of our ventilators free, 14 of the last 14 days. So we've hit that measure, and we know that we have adequate critical care supply. Now, some of the other measures that I want to throw out there that we are looking at, again, in our testing capacity, we talked about wanting to be able to test 5% of our population on a monthly basis. We've made significant strides in this area. And as I mentioned before, we will be releasing and announcing a high throughput option once we can finalize the contract negotiations. That will significantly increase the county's ability to offer testing to, in particular, its essential employees and first line responders, to also help us with make sure that our nursing homes and assisted living facilities get the testing that they need. And so we're confident that once we get that up and going in the next day or so, that we will meet that threshold. The next threshold that we talked about is test positivity. This is another one that we're a little high on, and we'll continue to have to monitor. And test positivity refers to the percentage of folks who test positive when you actually take a COVID-19 test. Our numbers have settled in around the 22% range compared to the state average of 19%. And certainly we want that number to come down even more. Below 15% is our threshold, and go even lower as we start to test more people and hopefully drive COVID-19 out of our communities. The other measure in terms of our equity measures, we have talked about making sure that we have provisions in place that are looking at data in different ways by demographics, age, gender, race, and geographic location in the county. We've made significant strides before this press release in putting in metrics to make that happen. And we continue to look at ways that we can beef up and bolster our ability to link access to social support services to our testing opportunities. And with increased testing capacity, that has allowed us to form more partnerships with our community agencies and social support agencies, particularly the Department of Health and Human Services, to make that happen. The last piece I want to highlight is contact tracing. As I mentioned before, we are working closely. We've continue to do contact tracing on a local level, but the state has introduced another opportunity that we've partnered with them that will go live this week, where they have contracted with NORC to provide over 1,000 additional contact tracers as an additional resource to the local jurisdictions. That added capacity will allow us to be able to contact the majority, if not all, the majority of individuals within a 24-hour period and initiate the contact tracing effort with their contacts within 48 hours. So I say all of this collectively to highlight the fact that we are making positive strides. We're moving in the right direction. We are closer to reopening in some capacity, and we will continue to work with our partners in neighboring jurisdictions to discuss what that looks like. We've had a number of conversations already to determine, based upon the data and our level of readiness, what would be acceptable provisions to open up. And I know the county executive will talk a little bit more about that in detail. So I won't steal his thunder, but I do want to assure folks that we are making strides. We're moving in the right direction. And although we don't have a definitive date, we're hopeful that we will be able to start to reopen some aspects of phase one within the next week or so. Thank you.
Thank you, Dr. Gales. And Mr. County Executive, if you could expand upon what Dr. Gales said, and given that time frame, and although it's not definitive, how you would reopen the government based on that time frame of potentially a week to two for a phased-in approach to reopening.
So, assuming the data generally continues the way it is, the way it's been, we should be able to accomplish this within the next week or two. And I've always been reluctant to put out a date because the date becomes the story rather than the conditions in the county being the story. None of us is happy being closed. All of us would probably like to go about resuming more normal-ish lives than we've been able to live under this. But if everybody's focused on a day instead of thinking about what it's going to take to get to that day, I think it just creates more problems than it's worth. So I don't want to promise a date. I think the data that Travis went over is really, really important. I look at this data every single day. This is how I start my day, is going through these data briefings. And it has been challenging in terms of how you present it in a way that's coherent to people and what you say about it. And so, you know, Dr. Gales talked a little bit about this. If we had put up a chart with the metrics we had, which is declining 3-day average and sustained decrease over 14 days, yesterday's data would have reset us to 0. And because we're looking at the longer trend, and we were hoping that yesterday was an outlier, and today would indicate, well, at least it wasn't sustained over 2 days. 102 is one of the lower numbers we've had in terms of cases, new cases. We didn't want to put data up there in a chart that would then trigger a restart at 0, but we need to have some coherent explanation for why you don't include an outlier or how you treat an outlier when you're looking at data overall. And so we didn't want people to either feel it was hopeless, and we didn't want people to feel like it was definitely going to happen in 4 days. If they could just count off 4 more days, everything would open. So we're going to put up a set of charts, hopefully this afternoon, that take into account some of these nuances we think people have to be able to read, so that people have a confidence level that we're actually moving in the right direction. We're going to be able to do this. We've talked about reopening. We're talking about what kind of criteria are out there. I listened with great interest to the governor's comments about the pledge. He had a pledge which he asked the businesses to take as a condition of reopening. I found the pledge, and I looked at many of the conditions in there. And my feeling was these ought to be the conditions that businesses agree to reopen. They involve social spacing. They involve cleaning of surfaces inside the workplace and the wearing of masks. And I think if we can get agreement that these are going to be the conditions, at least through the medium term, until we get further down the road with this virus, that opening is going to become more possible. But it's all dependent on people following the rules. The numbers still continue to trouble me a little bit, because you have to think that the 533 cases came from somewhere. And that tells you that 533 people had contact with infected people who weren't in hospitals and got sick themselves. And that those 533 have quite possibly been walking around for the last week or less carrying the COVID virus. Because remember, our testing is heavily oriented toward people who are symptomatic. And we know that this can be spread by people who are asymptomatic. And so it worries me that those many cases are still out there. I'm wondering whether I'm going to look at a peak 4 to 7 days from now that are the people that these 533 people had contact with before they were identified as positive. Is that going to show up a week from now? So um, interpreting this and making a decision that protects Montgomery County's health and welfare, we've got to get this right. But we're going to move, hopefully as soon as possible, toward a reopening, a gradual reopening. I do think the curbside pickups are things we're going to be able to do. I worry less about the transmission between the merchant and the buyer than I do about the conditions inside the stores themselves, where it's equally important that there be, the separation and the physical distancing. We'll consider, and I know the governor is considering, somebody asked me, could they do outdoor yoga classes? And I said, well, you can do 10 because the governor is still not allowing outdoor gatherings of more than 10. If that guidance changes, then our guidance will likely change. So some of the stuff is that's restrictive is still coming from the state, and some of it is our own data, which we did not think showed what we would need to actually reopen. But I am actually confident that we will move toward reopening. We'll do it gradually. The pace will depend on control of the cases and the hospitalizations. And I want to point out that the ICU beds are really critical. Yesterday we had 19 free. And why that's important is because it tells you that if you were to get a spike in cases, if we were to reopen and see a serious uptick in cases like the ramp that took us to where we are now, if that were to resume, we would swamp hospital capacity. And we can't afford to do that. So hopefully that number will go on a downward trend. We'll have more ICU beds open, and everything else will work out in the way that we do this sooner than later. But again, this isn't a decision we make for any other reason other than the health data tells us it's not the best idea right now.
All right, Mr. County Executive, thank you very much. And we'll start off with a Q&A from the members of the media, beginning with Rebecca at the Washington Post, who has a question for Dr. Gales about mobile testing and nursing homes. Go ahead, Rebecca.
Hi, Dr. Gales. Thanks so much for doing this. I'm wondering if you can provide an update on the hotline as well as on the mobile clinic. How many people have been referred through the hotline? Is it reaching the people that the county wanted to reach? And then second question, also wondering if you could provide an update on the status of nursing homes in Montgomery County. Do you have a sense of how many of them have been through the universal testing that Governor Hogan promised?
Sure. Good afternoon, Rebecca, and thank you for your questions. For your first question in terms of mobile helpline, so we renamed it last week. We to the mobile testing helpline as opposed to hotline, and that did go live on last Wednesday. And we have had a number of folks call in, and the way that works again is individuals call in, their information is gathered, and they are referred to a provider they have a scheduled time. The provider contacts them. They go through the triage and screening process, and then they are referred to one of the different testing sites we have, the alternative test sites. And so that process has gone smoothly so far. It was a soft opening. So I think as of today, we've had maybe over 25 to 30 individuals who called in and utilized that space and have been able to get linked to testing services through our alternative test sites. I want to also emphasize is that, again, with increased testing capacity, we've been able to increase the number of tests that we can offer at each of the sites. And we are close to, as of now, without any of our high throughput options that we're going to add, we're close to servicing the ability to offer over 1,000 tests to individuals on a weekly basis through that mechanism. And my understanding is, as of this morning, we've tested over 1,800 people collectively throughout that process. Onto the second question related to nursing homes, you are correct. The governor's special advisory team on nursing homes that is working with the National Guard have scheduled visits and are providing test kits to a number of facilities. As of this morning, we know that approximately 25 of our 33 nursing homes have been scheduled for visits, and we are following up with those remaining facilities. Excuse me. um, to see if we could potentially provide additional support to bridge that service in terms of making sure that all of the residents and their staff get the testing as the governor has previously directed.
Thank you, Dr. Gales. Chris Gordon with Channel 4 has questions for both the county executive and Dr. Gale. So let's start with the county exec if possible, Chris.
Yes, we will. Hi. You've been very thorough in the kind of data you've been sharing with us. So I'd like to ask the county executive, what is it you're looking at to be comfortable with order reopening? Now, you said it could be within a week or two, and because of Memorial Day and I guess the business owners are watching very closely. When can we get opened? Week or two is a fairly significant difference for them. So to County Executive Elrich, what would make you feel comfortable to order reopening? And Dr. Gales, where do we stand on the metrics that the County Executive is looking for?
So frankly, what would make me feel comfortable on reopening is when my health official turns to me and says, I think we're in a condition now when we can reopen. That's what would make me comfortable. I look at the data. Mm-hmm. I would like to see a drop in confirmed cases. Even if it comes amidst bigger testing, which might produce more positives, I'd like to see those numbers, whatever they are, start going down. And, I assume you guys get the data from the states. You could do your own nifty little graphs of how many cases we've had. What you see is, there's a flattening of the curve with some up spikes and some down, I don't know if we call them down spikes. But you got highs and lows, and you've got numbers that are all trending around kind of a median. And when those things start going down, what it tells you is that there aren't enough people out there, and there aren't a lot of people out there infecting new people. That's the good news. And that the fewer people that I see every day with a positive test, that means the fewer people they were able to infect before they were identified as being positive. Those two things I would consider really important. The hospital bed rate, particularly the ICU rate, knowing that if we do get a spike, there's a place for people to go, that is really important to me. So I want to see those numbers down. The death rates, to be frank, aren't going to be changed by stuff we do in terms of testing or contact tracing, because those are the rate of people who are already in medical care. And we know that, this is a hard illness and that people are going to die. And that may be the hardest number to change, at least to change in a way that gives you a level of comfort. I mean, I'd like to see no deaths. That's going to be a while before we get to that point. But I think that's really the cases and the hospital capacity that weigh most heavily on me, because the cases are the kind of predictor of how many unseen things are out there and how many unseen things may have impacted people over the last, or will be impacting people over the next week, because they were active and infected for the last 4 to 7 days, most likely. But I want Dr. Gales to be able to turn to me and say, we agree, and the health officers in general agree, that these are the conditions that make this safe, and then we'll do it.
Dr. Gales?
Sure, I would add, it's a pleasure working with a county executive and a county council who understand the value and importance of science and data in terms of driving these decisions and making these determinations. And so, all of the measures that the county executive mentioned, the things that we're looking at, I think one of the things that I want to emphasize that allows us to be maybe a little bit more comfortable in moving forward is the fact that we will have increased testing capacity. That has been something that has been missing significantly across the board. The ability to be able to test not only symptomatic individuals, but asymptomatic individuals also allows for the opportunity of identifying some of these cases that otherwise we wouldn't have known and interrupting the potential opportunities for any type of unknowing transmission to other folks. So the more folks we can test, including those who are asymptomatic, the first line responders, and also making provisions. So as part of the contact tracing effort, if, Chris, you've tested positive and then, you've identified me as a positive contact, I can get tested very quickly and then get those networks of transmission figured out in a timely manner so I can be effectively isolated and any other contacts can be quarantined quickly to prevent the other opportunities for spreading. So I think it's not only those indicators, but it's also the capacity component. And as we move forward and as we make those decisions, we're also looking to science to see how science moves forward. So for example, to County Executive Elrich's comment about the death rates, certainly we want to see that drop. Now we're starting to see provisions of remdesivir, the medication that has shown promise in treating those who are most severely ill. That is starting to filter into our hospitals and health systems through the state and through the government allocations. So it's hopeful that all of these things working together will get us to the point where we're seeing less cases, we're seeing less death rates, but we have the mechanisms and infrastructure to be able to test and identify folks quickly.
I want to add in here, if I may. Am I still on the mic there?
Yes.
Okay. Two things. The remdesivir is really interesting because I actually was on a conversation with the heads of one of the hospitals in the county today, and I asked them about remdesivir and how much did they get. And this is the thing. This is where people's promises don't match reality. He had enough doses for 3 patients. That's what they got. And they're hoping to get more. If this was widely available, if the blood plasma treatment was widely available, they've done a number of treatments with that. He seemed to feel pretty positive about that. But until it's fully approved by the FDA, and then we start collecting and doing a volunteer blood drive to collect the plasma of previously infected patients, that's not going to be available. So you look at glimpses of things and you realize there's a lot of possibility here that could bend these curves and alter not just the infection rates, but the outcomes. The other thing I want to say is on the contact tracing. Contact tracing in the absence of testing consisted of identifying who is sick, identifying who they'd have contact with, and telling them to go home and stay in bed and let us know if you get sick. So what you lose in that is you don't know who they contacted. And so you don't know which ones of them are going to turn positive until they actually get sick. And then you don't know who they contacted. And then you've got to send out another line of contact tracers. If we get when we get enough testing kits to do this, it's going to mean I know who's had contact with the person. I test the people who've had contact with the person. I take a positive test. I right away start another contact trace, and we'll be able to do what we weren't able to do before. And that's the kind of thing that brings this virus under control, is isolating the people who are sick as quickly as possible so they don't go through that period when they're spreading, and they're spreading because they don't know they're sick. If we could eliminate that period or cut it down to just a day or two, it would have an impact on how many more infections get spread in the community. So I think that, contact tracing is going to be critically important for us to do, and to do it with tests.
Thank you, sir. Rachel Bay is with WYPR and has a question about the pace of reopening for Dr. Gales.
Hi, Dr. Gayle. So I wanted to clarify something that you actually said during a meeting this morning with the General Assembly members. You talked about the pace of reopening, and you said, I think we may be able to open up some opportunities, but I don't think, but I'm not sure we'll be able to achieve the full level of phase 1 opening that the rest of the state has. Can you clarify what you meant by that, and combine that, clarify how that meshes with what you've said during this meeting as well?
Sure. So it's actually consistent with what I've mentioned and the county executive has mentioned, is that, as we continue to look at the measures, particularly if, we may have some measures that lag behind. So let's say, for example, next week, a lot of the measures and indicators are moving in the right direction. and not all of them are quite there, but are trending in that right direction. We may say, we, in the context and larger scheme of things, we may feel comfortable opening up, making some provisions. So as he mentioned, for example, opening up curbside retail as opposed to opening up the entire store with capacity limits. Those are the kinds of things that we would think about and consider. But again, we're not committing to anything. What I can say right now, where we are, that's probably more of a reality as opposed to a larger full phase one effort. And I want to emphasize that we continue to work and talk with our partners in other jurisdictions to think about how we can do this and move together, because as we've emphasized before, the boundaries across the jurisdictions, people come and go pretty easily, and so we want to make sure that we are operating on a consistent message to make sure that we ensure the safety of all of our residents.
Thank you, Dr. Gales. Tom Fitzgerald with Fox 5 has a question for you, perhaps both of you, about the new data dashboard. Go ahead, Tom.
Good afternoon. Thanks for doing this. It's a question about transparency in regards to these numbers. And Executive, I think you did address this in your opening, that when you said you didn't want to put data out there with no explanation because it could lead to some hopelessness if they were to look at a number like yesterday and then turn around and see a number about yesterday, about today. But the data dashboard, did you make a decision to not put that information out there for that reason? Because we've got a lot of people going around saying a lot of things, and information is power. So I want to know, why not empower people from the get-go with these metrics so they're saying and doing things based on fact and not feelings?
I don't disagree with you. That's why I'm not shy about talking about the data in the absence of putting it up there. I guess I'll say that when we look at just the raw data, you could draw the wrong conclusion. You see 4 or 5 days going down and people are going to say, well, you open in 9 days. Well, you don't know what's going to happen in the next 9 days. That's why people have tried to use rolling averages, for example. And when we looked at what happened, we realized that we had reset 3 of our markers down to 0 again. And so putting that out there that way would immediately have people think, my God, we're back to 2 weeks again. And as Dr. Gayle said, and I've said, when you deal with outliers are a known data thing. You normally throw them out, even if you're doing, when you do surveys and things, you take an outlier, you'd say, okay, that outlier doesn't fit with everything else, I don't count it. Our dashboard didn't show that. So we had to go retool that. So we're trying to make sure that we actually tell the story. The data is still going to be there. So people could dispute, I suppose, the story we're trying to tell. I'm sure you've experienced this. You put numbers out there and people come up with a different interpretation. That's always possible, but at least we don't want to say something that is deliberately misleading in all this. We'd rather get it right and take a little bit of time. And we had a meeting with the council, and some of the council members made good suggestions, like simple thing like put either a red, yellow, or green on the data to make so that people would know that this is not good data, or this is cautious data, and the green stuff is good data. It tells you you're getting closer. So we met with them, I guess it was yesterday, and we're trying to incorporate the changes they wanted to make into this so that everybody knows when it goes out, it tells the story that is the real story, and that we don't wind up implying things either way that aren't true. I don't want people to think there's no way we're getting to 14 days. And I don't want people to think that because you see 5 days down, that just means in 9 days we're opening. But we've been pretty forthcoming on letting people know what data we're dealing with. I can tell you any numbers you want, except for specific cases.
Okay, thank you, Mr. County Executive. It looks like Tom is trying to talk.
Dr. Gales, could I ask you, what is the most important metric out of all of these? Because there's been a lot to digest here. What's the most important metric you look for?
I think the most important, I'll say this, the most important take home message is that these decisions aren't made in a vacuum, and focusing on one outcome is not going to drive the entirety of the decision. There's lots of information we digest, and to the county executive's point, is part of our job is also making sure it is conveyed and disseminated in a way that folks can easily understand to be able to drive the decisions that they make as individuals and families and communities. We recognize that is a responsibility we have, and in this situation, we got to step up. We got to put the information up there, but we want to make sure that the information is right, it's comprehensive, and it's accurate. And so, to those in the community, and I'll be perfectly frank, I've received quite a few not so friendly emails about it, and that's okay. So we want to make sure we recognize our responsibility. We recognize that we need to step up in this role. We are doing so because we want folks to, again, trust that this is a transparent process, and we're sharing you the information that we have available to drive those decisions.
Thank you, Dr. Gales. Another question for you from Randy Bass with WDVM about testing.
Good afternoon, Dr. Gales. Following the governor's announcement about testing asymptomatic patients and expanding that statewide, what does that look like in Montgomery County? How can we implement that? And what does the timeline look like for that going forward?
Sure. So thank you for your question. I'm excited to, just as we took some hits recently on the data, I want to flip it to something that I feel like we have done a fairly good job on in comparison to other places across the country. We have worked very hard to create a buffet, again, going back to the term, a buffet of testing options that allow for folks to have access. So again, utilizing the VEEP stations where folks have been able to come in with appointments and get free screens. We expanded that to different community sites. We have stood up because we recognize that not everybody has access to a provider. Now, granted, the governor talked about changing that yesterday, but up until today, you had to have a provider to get a referral to get testing. So we stood up our mobile testing helpline. And we're working on other provisions to be able to stand up mobile testing arms to go out into the community and do direct testing, which in fact we already have been doing to some degree, partnering with the state, with the ready responders going to family homes, as well as our shelters and other places where we've identified where there are folks who are at high risk of transmission. So I feel that we have already, many of the ideas that the governor put out yesterday in terms of creating more spaces for testing, we have already been working on and have implemented those strategies. And again, the other mechanism that we will be launching shortly is, at least in the beginning, testing, focusing on those who are our first line responders, our essential employees, and for those who are asymptomatic individuals. I want to also highlight a couple of weeks ago when the CDC did change its criteria to put in provisions for those who are asymptomatic to get tested. We did send a memo out to the provider community, encouraging them to, when looking up asymptomatic individuals, to consider testing individuals who were contacts of known positive cases of COVID-19, essential employees and first line responders, because we know those folks are at increased risk because they've had to come out in the world and keep our operations open so all the rest of us could benefit from that.
All right, thank you, Dr. Gales. And that we have no further questions from members of the media. I will share a question from, I believe, a resident asking, how reliable is our testing and what is the daily testing percentage at this point of the Montgomery County population?
Well, and that's an excellent question. I don't have the daily test numbers because part of that is tests come from different places. But what I can tell you is we do have, today is Wednesday, as of Monday, we had tested approximately 3.4% of all residents in Montgomery County. And that represents over, I think it's well over 30, close to 40,000 individuals. And again, our goal is, and that is using the current system with having to have an appointment using nasopharyngeal swabs. And we recognize as we move forward, as more less invasive testing mechanisms come into play, stay tuned for that. we will be able to increase significantly the number of folks who can get tested because that will change the requirements of protective equipment, the level of employees needed to collect those samples. And so I say all that to say that we're at 3.4%. We've got to increase that number because we also recognize that one of the provisions with testing, particularly for a lot of first line responders, is we'll have to repeat the testing to make sure that folks stay positive as they get exposed to more and more folks.
All right, we have hit the 45-minute mark, and we appreciate everyone participating here today. We will obviously keep you posted as to when that new data dashboard is ready to go. And we will continue to update every bit of social media, news releases, newsletters, etc., that we can to keep you advised as we move towards this road to reopening. So thank you so much for being here this afternoon, and we'll see you here again next Wednesday.
Thank you all.
Thank you.